I want to thank everybody for joining us today. My name is Tony Chicotel. I am the Senior Staff Attorney for California Advocates for Nursing Home Reform. Before I begin, I really want to just thank all the media reporters who are joining us and those who aren't for their sustained interest and reporting about what's going on in long-term care facilities. The public and our policymakers have probably never been more aware than they are right now of some of the rotten conditions in some of our long-term care facilities, and it's almost entirely due to your work. And I am positive that a lot of this work has led to quality of care, quality of life improvements, and has laid the groundwork for lots of other improvements. So thank you very much. The last 2 years have been awful for long-term care facility residents. It's been awful for many of us, but it's been spectacularly awful for long-term care facility residents. The sickness and death alone are horrific. We've got now over 13,000 long-term care facility residents at least have died of COVID-19. But the way folks are dying, alone and cut off from loved ones who are locked out of their buildings, has been especially heart-wrenching. From the start of the pandemic, cutting off visitors from getting in to see their loved ones has been part of the COVID playbook. The thinking was keeping the visitors out would keep COVID out. Well, that's been a complete failure. COVID did get in pervasively, brought in by facility employees. Meanwhile, residents are suffering immeasurably from neglect and isolation. Last November, CMS largely restored full visitation rights in nursing homes, and we were elated. CMS cited that the cost-benefit analysis in facilities has really changed since we have great vaccination uptake among the residents in facilities. But some folks in the nursing home industry panicked when the CMS guidance came out, and they pushed back on that. And I think this push was largely motivated about maintaining control over visitation, and safety was just sort of an ancillary concern. Late on New Year's Eve, California DPH issued a new order requiring all visitors, regardless of their vaccination status, to have proof of a negative test before they could visit their loved ones. The order went into effect last Friday. Given the difficulty in finding tests right now, the order is essentially a lockout of visitors, and it is complete nonsense. First, the testing requirement being applied to visitors does not apply to the facility staff. So we have a situation where even unvaccinated staff have less stringent testing requirements than vaccinated visitors. Second, the testing requirements expressly do not apply to hospital visitors. And for the life of me, I can't understand why that might be. Third, we have a situation where residents can go to NBA games and sit with 20,000 screaming fans in an arena, but they can't get a socially distanced visit from a spouse or a son or daughter in their own home. And last Saturday, this is the fourth thing, which is sort of the coup de grace. Last Saturday, in an act of screaming discrepancy, the state issued a new order permitting COVID positive staff in nursing homes to continue providing care. No quarantine period, no requirement for a negative test. Why is that? Why is it that we're allowing staff to bring COVID into the nursing home and we're keeping visitors out? And I submit that it's because nursing homes are calling the shots. The facilities want regular staff to stick to their shifts, and they don't want to pay overtime. They want visitors under their control. This is not about safety. This is about capitulation to what the industry wants. Before the pandemic, control over visitation was with residents. The facilities are the residents' homes, and the law gave residents robust rights to see visitors. Since the pandemic, however, control was taken from residents and given to facilities, many of which were already inhospitable to visitors. You see, visitors are the greatest source of protection for residents. They identify neglect, they voice concerns, fix problems, and they often provide direct care themselves. As strong critics of poor care practices in bad facilities, visitors are often seen as the enemies of the facilities. And then we have the same old garbage that always plagues long-term care. We have ageism and paternalism. We have rulemaking about residents without including residents. We have facilities treated by government agencies as customers, and we have regulatory inconsistency across the state and non-enforcement. So what are we asking for? We're asking for a few simple things. One, to get the tests to be provided on site. If we want a testing requirement for visitors, let's get the tests into the building so that the visitors have access, rather than being forced to get in 4 or 5 hour long lines and try to book something on the internet that's nearly impossible. If we can't get the test to the facilities, then drop the testing requirement. What the visitors bring into the facilities is just too darn important to keep them out. Value the visitors the way we value the staff. They'll comply with infection control protocols, the same protocols that apply to the staff, but they don't want to be subjected to protocols that are more strict than what the staff are required to comply with. And last, we can pass some essential caregiver legislation. Essential caregiver legislation, which we'll talk about later, will stop this roller coaster of visitation that the residents have been on for now 2 years, and they really want to get off. So that's all I have to say for now. We've got 3 great speakers to talk more about this issue and talk about their personal stories. I want to first introduce Andrea DuBrow, who is she's a MSW MPH and president of the Family Council at the Rutlinger, which is a Bay Area facility that has both assisted living and a nursing home. And I believe Andrea's mom is in the assisted living unit at the Rutlinger.
That's right. Thank you. Thank you to Tony and CANHR for inviting me to speak today, and to all of you who are listening. I'll just share my story briefly, and then I'll be happy to take questions. And I hope that this is helpful to understand what a family member is going through. When I learned of this policy, my stomach sank in the same way it did in March of 2020, when the shelter in place meant that I was locked out of the facility that my mom lives in. My mom is 75 years old and she suffers from Alzheimer's disease. Every week I visit to basically lay eyes on her, as the saying goes, because she can't speak for herself anymore. She can't tell me if she's happy or bored or lonely or cold or hot or hungry or in pain. She cannot express herself with any accuracy over the phone, and she certainly cannot understand, comprehend, and relate to what a video chat is. Over the last 2 years, while we've all been facing COVID, her dementia has gotten much worse. Lockdown, masking of smiling faces, and the passage of time have not been kind to her prognosis. So when I wasn't able to get my PCR COVID test result within 48 hours from last Thursday morning, when I got swabbed at a local testing site, I knew I was in trouble for my usual Saturday visit. The test results did not come on Sunday either, or Monday morning. In fact, it took 104 hours for me to get my results. That's more than twice as long as the state is now saying is required for me to produce a negative result that will allow me to visit. And while I was waiting those 104 hours, I called every CVS, Walgreens, and Target store and individual family-owned pharmacy I could find that was within a 25-mile radius. Guess what? None had tests. I am the chairperson of our Family Council, which is a group of families at the same facility where my mom is. Our email chain was going wild over the weekend, and in fact, it still is. People thought they found rapid tests, only to run to the store and learn that they were out of stock. Others were placing expensive online orders for rapid tests that hopefully will arrive in 2 to 3 weeks. Family members who live out of town expressed worry that their tests would not be valid by the time they got here to visit their loved ones. Or if they were staying in town for multiple days, where would they go to get new tests while visiting from out of town? They didn't know the local resources. Plus, those who cannot afford these tests, who cannot afford to buy these rapid tests, or who have no time to track one down and stand in line, as Tony said, are even more disadvantaged by this new guidance. In the time my mom was not able to see me during the first lockdown from COVID's onset, she forgot who I was. With Alzheimer's disease, I can only try to slow that process down by visiting her often, while also providing care that she needs. So this latest restriction is essentially another lockdown, since we completely lack adequate supplies to meet its mandate. Testing is a great idea when we have the supplies to do it. The time that my mom has left when she can recognize in some small locked away part of her being that it is me, her daughter, cleaning her, feeding her, holding her hand, singing her favorite songs. That time is now being stolen from us again. And it is also this way for so many of our elders. It is time to stop locking out families because we are essential. Thank you.
Thank you, Andrea. Thank you for sharing that story. I'd like to next introduce Matt Borden. He's a lawyer from Braunhage and Borden, and he's an impact litigator and someone who works frequently with California Advocates for Nursing Home Reform. We're very thankful to have him in our corner, and he's an expert on the interplay between state and federal policy and law here.
There we go. Thank you, Tony, and thank you, Andrea. Kind of a hard act to follow. I don't have it's a very compelling story of, just how impossible the new regulation is and how it's effectively a lockout and the real human impact that it's having. And I think this is something that CMS has recognized in they passed a reg and there's an absolute right under federal law to visitation, and especially visitation by your family. And it's considered to be a fundamental right. And the federal regulation recognizes that, in terms of the risks that are involved, if you have somebody who is vaccinated and they're wearing a mask, and you have, generally good vaccination rates, especially, in our state, that's a much less or a smaller risk of giving somebody COVID than the known risks and the known harms that happen when you isolate people and when you don't let them have visitors. The effects are profound, and we just heard some of that right now. So it's illegal. What the state is doing is violating federal law by sort of interposing all of these barriers that make it impossible to have a visit. It's something that, we were hoping that CMS would address, but CMS hasn't seemed to have done anything, and it's something that the state should definitely address because what they're doing is unlawful. And I'm happy to answer questions that people have, but that's the kind of state of play from the legal world. It's just not lawful, and it doesn't jibe with federal policy.
Thank you, Matt. Our last speaker for today is Maitely Weismann, who is, I don't know what your official title is, but she's definitely an integral leader at the Essential Caregivers Coalition. I think that was an organization that was sort of thrown together in March or April of 2020 when the visitation lockouts first started to happen. And they've been a crucial resource for us, and I think for policymakers in understanding how these policies are impacting residents and their families.
Hi, Tony. Thank you so much. Yes, I am a co-founder of the Essential Caregivers Coalition. And in fact, we actually were incredibly patient. We didn't form our organization until June. It took us a while. We thought we could get in. We thought we could, explain away how important family is, and that there really wouldn't be an overwhelming amount of us coming in, but just perhaps one person who could be a reasonable accommodation for residents who need us inside. Our organization was founded by family caregivers with loved ones locked inside of long-term care homes. And as I said, our loved ones traditionally rely on us to provide personalized care on a regular basis, sometimes even daily, like my mom. She's 79 and she has quadriplegia and cognitive disabilities as well as communication disabilities. During this pandemic and still today, as we've just heard, the doors to long-term care homes remain effectively locked to visitors. Our care is especially important in a pandemic when staff is stretched beyond their limits, leading to lower quality of care and neglect. Without routine access to their family caregivers, residents lose their will to live. They die of causes such as failure to thrive or suffer serious physical and mental declines. This is largely due to the dehumanizing isolation and neglect, which go largely unchecked during these lockdowns. To mitigate this risk, essential caregivers ought to be designated as a, like I said, reasonable accommodation during facility lockdowns. The essential caregiver is so much more than a visitor. An essential caregiver is a close family member or a close friend, and most importantly, they are chosen by the resident. We enhance the efforts of facility staff with our direct personalized care, emotional support, and companionship, among many other day-to-day support activities. Essential caregivers provide a unique bond. They don't displace facility paid caregivers, and they adhere to the same public health safety protocols required of that staff. Due to the complex distribution of regulatory authority among the many types of congregate care facilities throughout the US, our coalition is working on legislation at multiple levels, federal and state. Federally, we're part of a nationwide movement, which is responsible for the Essential Caregivers Act. That's HR 3733. It was introduced in the House by Representative Claudia Tenney in June of 2021. It is bipartisan. Passing this bipartisan bill will ensure that during a facility lockdown, residents are always able to receive personal support from one of their essential caregivers in such a way that sustains their right to privacy and self-determination. Participation is contingent upon strict compliance with the facility's safety and health protocols, standards for staff, same as staff. We currently have 28 co-sponsors on this bill from both sides of the aisle, and that's HR 3733, the Essential Caregivers Act. For California state, we're currently seeking an author for a state bill which would serve the same purpose as our federal bill, only it would be focused on locally regulated facilities. We've been meeting with California state legislators since March of 2021. Many staff members have expressed concern about risk to public health. They're not in our shoes, they don't understand that in the current public health strategy, there's a glaring lack of interest in public health harms that you find in isolation, neglect, and blatant disregard for the whole human. Additionally, we're committed to following infection control protocols that would be required of staff in the facility. So as Matt pointed out, masks and vaccinations at this point really reduce the risk a great deal. We must strike a balance. We must allow for this reasonable accommodation when it is proven that family support is essential to the health and well-being of residents who traditionally depend upon it. Furthermore, this population requires proper independent representation at the decision table. This bill will go a long way towards satisfying those needs and more. Thank you.
Thanks, Maitely. I'd like to open up the floor, so to speak, for questions, but just one thing that occurred to me is that this whole visitation thing since the jump has been incredibly frustrating, and I thought we were all past this, but when you hear from the residents and the family members themselves who care, there's nobody who cares more about the residents than their family members and their loved ones. And they are crying out that this is the wrong policy. And yet we have policymakers who continue to think that they know better what's best for these people's loved ones. And I just think that it's incredibly paternalistic. And I just wish that the policymakers would consult with residents and their loved ones before they start adopting policies like this that effectively end limit their relationships significantly for long periods of time. It's breathtaking. Okay, if there's any questions out there, we'd be happy to answer them. or any points that anybody wants to make. And feel free to just go ahead and unmute yourself or put a question into the chat.
Thank you. Yeah, I'm Miriam Raftery, and I'm a journalist, but I've also been through this nightmare with my mom, who suffered a devastating fall in February at home. She has Alzheimer's, 91, fell, broke her back and her sternum, wound up in a nursing home, and subsequently 3 other long-term care facilities after that. The lockdowns have been terrible. So thank you for fighting for that. But one of the problems we ran into was at the first place, she kept falling out of bed and getting hurt over and over again, seriously hurt. They didn't have enough staff to watch her. They didn't have the right protocols. They refused to allow family in. And yet they told me if they would, because of the repeated falls, they were going to send her back to the hospital indefinitely, which was a nightmare for her, unless I would pay out of pocket $30 an hour for full-time, 8 hours a day, 24 hours a day care for her. So I had to do that for a month. It was over $30,000 out of our pocket to keep her alive. I think it was criminal. I'd love to know if I have any legal recourse over this against anybody. But also the other thing is, if I love the idea that you're saying, family caregivers should be allowed in, but it needs to be more than one. In my case, I work full time. I can't be there every single day. And when I'm not, and several times I've been exposed to COVID myself, had to quarantine. So I would send another family member, my son, my husband, my brother. I mean, it ought to be the caregiver or whoever they designate in their place if you're not able to go yourself. And testing it, I'd prefer no testing, because even testing at the facility, I'm told you have to wait 30 minutes for the result. A lot of times I'd be running over on a lunch hour. I'd only have maybe 45 minutes to visit mom. I take her out of the facility that I'm paying out of pocket for physical therapy now, because Medicare completely eliminated it, even though she still can't walk without assistance and is getting weaker, not stronger. The facilities refuse to walk her. They're all too worried. And now she's, on top of everything else, she's tested positive for COVID and been put in isolation all by herself. So I'm again paying for, I found a caregiver willing to risk that and go in to be with her. But it's just been a horrible, horrible nightmare. I don't know what else can be done, but like I say, especially at the first facility where they were making us, the caregivers they made me hire were not, some of them were not vaccinated or not required to be vaccinated. And yet I, as family, could not go in to protect my mom when I was fully vaccinated. So it's just been horribly hypocritical. The place she's in now do require everyone to be vaccinated and visitors to wear N95 masks. And even that didn't keep COVID out. But speaking as a daughter and a caregiver, I would rather risk COVID. I mean, if heaven forbid she would have passed from COVID, I would rather deal with that than deal with her being tortured, with being isolated, falling, afraid, neglect. I mean, we've had myself or private paid caregivers pick up UTI infections and all kinds of other problems that these facilities didn't even notice. And it's been a problem in all 4 of them. So that's all I really had to say. But, I don't know what else can be done.
Well, thanks for sharing, Miriam. Just want to address one point.
Mm-hmm.
The problem of understaffing in a lot of long-term care facilities certainly predates COVID-19. And we've had sort of a longstanding chasm of understaffing in some of these facilities.
Mm-hmm.
And one of the things that we had to fill this gap, at least partially, was the unpaid volunteer support and caregiving of the family members and friends. And
Mm-hmm.
a lot of family members and friends, very quietly performed all these essential care functions to compensate what was not being provided by the facility itself.
Right.
And when we lock out those visitors, we are increasing this gap, and it's just going to lead to more problems. And on the issue of requiring you to pay for additional care, I'll tell you, under the law, facilities are required to provide all the services necessary for residents. And if they're telling you that they have a shortfall, well, now there's requirements that they report those shortfalls. And I'd be interested to know if they're reporting that. But this is something that's often done to consumers to put the blame on not getting enough staff.
I filed state complaints and county complaints. I called everybody I could think of, and nobody helped us. We just had to pay the bill. But
it's a common problem. So I suggest you just give me a call after this, and we can talk about that.
Okay, send me your phone number. editor at eastcountymagazine.org is my email.
Okay, I think I have your contact information.
Thank you. Thank you very much. I applaud what all of you are doing. It's great to see somebody finally fighting for these poor residents.
All right, is there anybody else with any questions or comments?
Hi, Tony.
Yeah. Hey,
Tony?
Oh, no, go ahead. Let Susan go first.
Oh, okay.
Hi, Tony. This is Susan Jaffe with Kaiser Health News.
Hello.
Can you hear me?
Yes.
I may have missed this, but what response, if any, have you gotten from the state?
We essentially have no response from the state. Matt wrote them a letter before the December 31st order saying that you're non-compliant with the federal law. And instead of getting a positive response, they issued these new policies that are even worse than we had before. So maybe we should stop asking them for anything because things just get worse. I wrote to Secretary Ghali last week, and he acknowledged receipt. He's the director of the Secretary of Health and Human Services in California. He acknowledged receipt of the letter and said that he would get back to me or he would send it to his team. I really think that the state is going to completely ignore us on this, that they're not going to change their policy, and that we're just going to have to hope that some facilities don't comply and continue to allow these essential visitors into the building. I don't have any hope that the federal government's going to crack down. I really think it's just incumbent on all the family members and friends of residents to continue to beat the drum in Sacramento and beg for policy change.
You heard anything, any response from CMS? Have you asked them to do anything?
Yeah, we've tried to talk to CMS about this and have not really been able to get that meeting yet. But they're certainly aware of our concerns, and they've told us that they want to make sure that the state is complying with the federal rules, but I've not seen any proof of that.
Okay, and just one last quick question. Do you know of any other states that are restricting visitation?
Yeah, I just read that New York State, which initially had aligned itself with the November CMS guidance restoring visitation, is now requiring proof of negative test before visitors are allowed in. But the big difference in New York is that they're requiring the facilities to provide the test on site. And that's a huge difference. If that were the case in California, we wouldn't be having this press conference. I would be working on other issues. There are plenty out there. But New York had the foresight to direct resources to the facilities to get the test done. San Francisco has done the same thing. I think that might be in the chat order, or the order has been put into the chat, so you can see what San Francisco did. They were requiring the test on site, which makes perfect sense. But if you're not going to be able to provide the test, then they're just not possible. They're not possible to get done, and visitors are going to be locked out.
Are you ready to take legal action?
We are strongly considering legal action. If we have any avenue if we think we have a viable avenue for legal action, we will take it.
Thanks.
Does anybody else have any other questions? Okay, well, if not, feel free to reach out to me at any time. I'm Tony. My email address is tony@canhr.org. Oh, Melody, did you want to say something?
I'm so sorry. Didn't mean
That's
to
okay.
interrupt, but just to underscore a couple of things that have been noted, as Maitely was mentioning, the laws that we're looking to get in place will have more strength to them. I mean, protocols, as we've seen, can change on a day-to-day basis. Guidelines can change on a day-to-day basis. The laws aren't going to. And first of all, that kind of galvanizes, I guess, what the protocols would be. It enforces them. And
the other part of it, there's confusion. I mean, just right here through the state of California and our California Essential Caregivers members, for example, the CMS guidelines from November come to state. Well, even if state changed their guidelines, county and then cities can even have different levels of guidelines, and then the individual facilities are open to adding to those guidelines. So that creates a lot of lack of continuity. It also creates a lot of confusion on the part of staff. One of the things that we've noticed is sometimes within a facility, the guidelines change on a day-to-day basis, and staff aren't always apprised of the update. So a family member may receive an email saying, "Oh, here's our guidelines for today," and they go to the door, and staff are saying, "No, we can't let you in," because so it would make the chain of communication much more stronger. And if I may just take a minute, I saw an email earlier today from one of our Essential Caregivers members in San Diego, and Maitely and I were talking to her last Thursday, and she said, "Oh, at my mom's facility, they called us and they told us, come on in, no restrictions. You can come on in any time. You can do whatever." And this was last Thursday. So 7:00 last night, she sent this email saying, "Update on my mom. Her roommate just tested positive for COVID. Her roommate moved in 7 or so days ago from the hospital. She either was exposed at the hospital or from a staff member at the facility, because staff who spend all day with the residents have much less restrictions than those of visitors. Lockdowns don't work. The roommate never left her room, which meant this woman couldn't get in to see her mom. CMS guidelines state if you're locking down the facility, you should not be taking new patients. I'm furious. My mom is depressed and said she's losing her mind locked in that room. Now that she will be locked in there alone with her roommate who has COVID, it's going to be even worse for her. How can they keep them locked in an infected facility in half a room for 24/7? It's cruel. I'm so over this. This is abuse, ageism. I'm done. Meanwhile, we run around spending money on tests when my time should be spent with her. Lift restrictions, lockdowns don't work." So it's maddening. It's like, hey, I'd rather do a calculus problem, and I'm not a math person, to try to keep up with all the changes. So the law being in place, the national law, which would govern nursing homes, and then the California law that we're looking at, which would encompass other long-term care facilities, and long-term care even includes children. There was an article that came out, I'm wanting to say 7 or 8 months ago, and it was a 1-year-old whose parents were restricted from coming in to see their baby for a year. So the designated support persons, the essential caregivers bill, would alleviate all of that and make a huge difference in life. So I guess just wrapping up on that, certainly if anyone needs assistance with interviews or information, I know I want to step in there for you, Maitely, to say, would be available to assist. And one of the biggest things we could help with is just getting the legislators to pick up the torch and run with it. Someone to be in the media saying, "Hey, legislators, you're giving a lot of empathy, but someone needs to be that person to step forward and to assist with this." So sorry, hope I didn't take too much time, but thank you so much. And if anyone has any questions about anything I just said, be happy to help.
Well, thanks, Melody. And if you and Maitely could put your contact information in the chat, I think that would be really helpful. And I think the point you raise is great. I do think that on this issue, we're going to have better traction with a legislature that is much more responsive to the people than with the so-called experts who seem to be so out of touch on these critical issues. So yeah, legislation is perhaps our only hope in the long run here.
So it sounds like while we're all waiting for the legislature to do something, the short-term action might be approaching our own county supervisors or city officials about passing an emergency ordinance that would do like San Francisco did? Would that be good advice to folks?
Yeah, counties and cities that have their public health authorities could pass their own legislation that would limit the scope of visitation restrictions in long-term care facilities or anywhere else for that matter. Of course, they would be limited in scope to those counties or cities, but that would be a start.
Right, but at least say requiring them to provide the testing, on
and for
site would be an easy one.
Yeah.
Thank you.
You're
Hey,
welcome.
can I ask a question, Tony?
Sure.
Are all the nursing homes enforcing this policy, and are any companies in particular doing it around company-wide?
I have the sense that a lot of facilities are not requiring testing within the parameters of the state order. I don't have any hard evidence of that, but I just suspect that it's happening for a number of different reasons. A lot of times the calls that I'm not getting are just as instructive as the calls that I am getting. And I think from some people that I would have normally heard from, I've not heard from them. And I think that they're still getting access.
Can you define what's considered long-term care facilities for purposes of this? Does that include things like a Borden care, a memory care facility, a retirement hotel? What is and isn't included?
The testing requirements apply to both nursing homes and assisted living facilities or adult and senior care facilities. And that's a pretty broad range.
Yeah.
That would include your boarding cares. There's about 7,500 assisted living facilities in California. There's about 1,200 nursing homes. Altogether, it's about 250,000 residents in long-term care facilities that are affected by these testing requirements.
Wow.
It doesn't apply to retirement hotels because they're not licensed by the state of California. And I know folks who are in retirement hotels, and they're allowing visitors in, and you don't have to be tested, et cetera. And they also get the county health department to come in and boost everyone.
Thank you.
Mhm.
Yeah, that's another great point. I really wish that instead of putting resources into who we can lock out of facilities, we would be putting our resources into getting the residents and the staff boosted. That's been a significant problem, is we've not had anywhere near the same public health effort to get boosters in as we did with the initial vaccinations. It seems like all the attention now is on visitors and staff testing requirements and coming into work with COVID as opposed to getting them boosted. And that's a real shame.
Mm-hmm.
All right, I want to thank everybody for participating today, especially our panel of speakers. I really appreciate it. Thank you so much. And if you have any questions at all or want to talk about this in the future, send me an email or give me a call.